We are here at WeDoctor, a digital platform which connects hospitals, doctors, pharmacies, the whole yard, and works for government, patients, and other institutions. And Ricky, tell me, when did WeDoctor get started?
That's about like 10 years ago.
10 years ago, okay. How many people work in the company?
It's around 3,000 people working for the WeDoctor.
And you connect all kinds of different people together. How many hospitals do you currently connect?
Well, so if you look at the number of the hospital WeDoctor connect, it's around 3,000. Yeah. It's about 3,000.
And doctors?
Doctors around 300,000.
300,000. And how many patients are using your systems?
Well, if you look at the registration patients, registration user is close to 200 million.
200 million. So you really have a Chinese scale at the moment. Okay. Now, what kind of services do you provide to these different, what are your clients at the moment?
So if you look at our clients, we got the government clients, we got the individual clients, and we got the industry clients. Industry clients means some pharmaceutical companies, some pharmacy companies, right?
Okay. So let's talk about these services. What kind of service do you provide to the individual clients?
Right, for the individual clients, you know, their biggest problem is that they have to wait too much time and they don't have a chance to visit a good doctor in the good hospitals. And
5 hours waiting time.
5 hours waiting time and 3 hours the talking time with the doctor. So we build a system to help them to make the appointments, help them to looking for the good doctor.
I can pay a little bit more than 200 RMB. I can pay 300 or 400, and I get immediately access to a doctor. I don't have to wait 5 hours.
All right, it works. That's the way.
And how much more do I have to pay for that service?
If you want to pay 1,000, you can pay 1,000. You know, the pricing is we got a different level of pricing.
You don't set the price. You just basically are in the middle.
The average number, right? Average number is around like 200. 200.
But if I pay 400, how much percentage of the fee does your platform take?
Right, it's pretty close to the Uber model, around 25% to 30% of the take rate.
So that is the individual service. Do you do other things for the individual consumer?
A lot of things, like we help them to manage their health, right? We help them to monitor their health. A lot of service, right?
And you have a lot of services available. You have a communication device, which I can have in my room, which I can basically do video conferencing, right? How many of those do you have installed?
Oh, it's 2 million, I think. It's 3 million or 2 million, right?
And then the basic, and I heard it was 5,000 RMB to buy the device, and then 2,000 for the yearly annual subscription, and that gives me a certain amount of services.
Right. Exactly, that's the number. 5,000 for the equipment and 2,000 or 3,000 for the membership.
You already have 2 million, but I also can just download the app and basically access those services on my phone, right?
That's the APP model. That's the model you can use in your cell phone. That's the lighter model, right?
And so I can basically also call doctors, get a subscription from doctors, and the whole. I can use it as a GP kind of entry level.
Right, definitely you can.
Okay, what kind of services do you provide for the government?
For the government, basically we're building the system for the government to help them to control the total medical spending. Help them to control, right.
So you have all kinds of nice dashboards here where you basically get information from all kinds of sources and you basically present that for the government, for the provinces and for the city government and for the national government.
Right, that's true, because the government, they need the data. They need the data to make the planning. They need the data to optimize their system. The data is very important, but WeDoctor have data.
You also say you have mobile hospital or mobile car. That's also you provide to the government?
Right, yes, exactly. The mobile vehicle clinic is the service we provided to the people living in the rural area, living in the countryside. They can have their physical check in the van, right?
And your whole model is you do not have the services yourself in-house. You use doctors from all kinds of places. You don't have the doctors on site. They're not on your payroll. You're just an Uber.
Right. This is Uber model, asset-light model. We are the platform. Right.
You're a technical company.
We're a technical company, right. We link everything.
From the 3,000 people who work there, what do they do? How many people are IT, etc.?
Right, so if you look at the 3,000 per year, we're not going to have around like 1,000 IT guy. 1,000 IT guy.
The other people, how many are in sales or marketing or?
Salesman, the sales guy, the BD guy, around 500, and there are some supporting team, right? Like the finance department, the HR department, right? It's a solid company, very solid company.
So if you talk about all the devices I saw, you have a clinic for inside businesses which can provide services, and you have all kinds of vending machines which provide medicine. Do you operate them, or do you provide them to other people and they operate them?
So they operated them. We just providing the technology. We just providing the network for them, right?
Yeah. And the hardware, do they buy it from other people or they buy it from you?
They buy from other people.
Yeah.
We don't
only have the subscription, the network, and all the service and
the network. The data is much more important.
Yeah. How fast is the company growing at the moment?
If you look at the revenue size, I can tell you the revenue grew about 10 times in the last 3 years. 10 times in the last 3 years. Amazing, right?
Mm-hmm. How much money do you basically? How much investment money goes into the company?
All right, let me tell you something about the last round of financing. We finished the last round of financing about 2018 April. We raised around 500 million USD. And the post valuation of our company for last round is 5.5 billion USD. Okay. Right, that's the last round. But actually, we are doing the.
That's 2018, and you have a new round coming.
Right, new round is coming. Right, exactly.
When do you expect the IPO to go?
The IPO, we probably will kick off the IPO next year. And if everything goes smoothly, we will finish our IPO process maybe in the early of the 2021.
Apart from making a huge amount of money for investors and for everybody, what is the goal of WeDoctor?
The goal of the WeDoctor is using our data, our system, our network to help the Chinese government, help the Chinese individual to solve the biggest problem in the medical system. Right, that's our goal.
So the government is client number one?
I think the government and the individual are the same top priority. Right.
What about medical pharmaceuticals? What do you do with drugs?
With the drugs, firstly, we're providing a pharmaceutical medicine transaction platform for the demand side and for the supply side. Basically, we combine the demand with the demand side, and we help them to negotiate a nice price with the supply side. That's the way we provide the service.
And how much? What is your business model? Do you take a cut from the orders?
At this moment, we don't take the cut, but in the future, definitely we can do that. Right.
So this is an investment opportunity because you're going to raise another $500 million in the next round?
Around 500 million, but the number is not decided yet. Right.
Around, okay. And what is the minimum amount of money which you can invest before the IPO? What is this private round which you have? What is the minimum?
Okay, I think for the follower investors, I mean the small investor for this new round, the minimum number of the amount will be around like 20 or 15 million USD. 15 million.
So that's a small 20 million. That's still quite a lot. If you want to invest $1 million US dollar, that's not possible.
Right, that's just for the smaller investor. We probably will have a leader investor. Leader investor will invest a big amount of money.
Who are your current investors?
Our current investors are a pretty big name like Tencent, Hill House. Hill House is a famous Chinese fund, and Goldman Sachs, and some PRC big banks, right?
It's mostly Chinese, or Goldman Sachs is an American company. Are there more external investors outside China?
Could you say again? Yeah. Could you repeat that?
Yeah. Are there more? Goldman Sachs is an American company. Are there more outside China investors?
There are some investors from the Goldman Sachs to some Chinese companies. Right.
Thank you for the invitation. Good luck with the next round.
Thank you very much. Keep in touch.
Yeah, we will.